Okay, I'm Chris Warren-Dickins, psychotherapist in downtown Ridgewood, and I'm joined by Olga Noskin, neurologist, also in Ridgewood. Welcome.
Thank you, Chris. Thank you so much for having me here. And
No
it's
problem.
nice to see you.
And
We're
nice to
both
see you
home.
Yes, we're constrained. Yeah, we're trapped.
We're looking
at home.
strange, but we're healthy, and that's always that's a plus. Thank you so much for having me.
No problem.
So yes, I'm a neurologist in Ridgewood. I've been in practice for the past 12 years. I'm a general neurologist, but I'm also a specialty trained neurologist in vascular neurology. And some of the things that I do and I like to help patients with is such conditions as strokes or post-stroke care, dementia, various spinal conditions such as spine injury or pain in the back, things like multiple sclerosis, peripheral neuropathies, various burning conditions and painful conditions. It's a lot of times what I see is that a lot of specialties, surgeons and various other specialties send patients to neurology because they simply come to the end of the road. They don't know how to help a patient. They've already done surgery. They don't know what else to do. A lot of patients whom we see in the hospital, specifically Valley Hospital here, we follow up these patients for years for the type of care that they may still need. And most importantly, I spend a lot of time with their families, explaining the condition to the families, the caregivers, and answer whatever questions they may have, and they obviously manage their medications if they require them.
Okay, thank you for that. Thanks for the introduction. I guess also, when would someone come to see you rather than a psychotherapist? Because they may come to me off the street thinking, I'm feeling confused, I don't know I'm suddenly noticing a lot of changes in how I think or how I see things. So how would they know to come to you rather than me?
Well, that's a great question, because I think that in my practice, especially with patients who've suffered strokes, traumatic brain injury, or those who suffer from dementia, for example, or multiple sclerosis, there is a lot of overlap between what I do as a neurologist and my fellow psychology and psychotherapy friends and colleagues. What happens is part of what I deal with is the brain, and our brains do serve a lot of functions. They don't only serve the function of walking and seeing and speaking, but also thinking and feeling. And those functions can be, so to speak, broken for neurological reasons and sometimes purely psychological stress reasons. Post-trauma of any kind, or just underlying depression. Some patients are predisposed either genetically or environmentally to having depression or anxiety, and it definitely plays a role in the experience of their neurological disease. And we can't always separate the two. So we do need both specialists to work both on the physiological aspect of their disease as well as yourself on the psychological aspect, and somehow come together and work as a team.
Yeah, okay, thank you for that. And you mentioned about post-traumatic issues, and I'm thinking about my work with, I use EMDR, eye movement desensitization reprocessing therapy.
Can you talk about that a little bit?
Yeah.
Does your audience know everything about it?
Sure, yeah. I help people resolve issues relating to trauma, including symptoms of PTSD, post-traumatic stress disorder. But I can also use that therapy for helping people who are just stuck. They've tried talk therapy and they're just stuck with these negative beliefs about themselves or the way they see the world. And it really just helps the brain get unstuck and look for more adaptive ways to view themselves or the world. We do use eye movements, replicating REM sleep, where your eyes are going back and forth. But we also kind of use other techniques like tapping to help people stay grounded as they're kind of reliving or remembering traumatic events, so they're able to get through to the other side instead of holding on to that traumatic experience and not getting through to the more adaptive way of living. But my question to you, given that I do EMDR and eye movements and things like that, when would I need to liaise with you? I mean, when is it safe or not safe to do eye movements, EMDR, if someone's maybe had a previous brain injury and they're asking me that question?
Okay. When you do, and I have a question for you, when you do EMDR, is there any flickering of lights that's involved, or any strobe lights?
No, I mean, some people, I use a pointer to help people move their eyes back and forth. Some people do use a machine where they're watching a dot of light go back and forth. So I don't know whether that falls within
that's an interesting, thanks. So, that's an interesting question. When would it be safe? As the way you're describing it, I do not believe there is anything unsafe in this therapy. And I'm sure there's a very large population of patients who would much rather try this type of therapy than any type of pharmacotherapy that I might offer to them, for example, which I typically try to avoid to the best of my ability and just try to discuss their symptoms and work with you. The only caveat would be if a patient, after a traumatic experience, an actual physical traumatic experience, may also be at risk for seizures or has had some kind of an epileptic syndrome. Sometimes we try to avoid any kind of flickering light or strobe light phenomena because those can infrequently provoke seizures. And that's the only situation where I would say a patient may have difficulty. The other aspect I would say, and this is something that you can easily recognize in your practice, is if a patient has had a concussion, for example, a physiologic concussion, sometimes their ability to sustain activity or concentrate on a certain activity may provoke symptoms of headache, especially early on, or symptoms of fatigue and so on. So they may simply not be able to tolerate a lengthy task of this sort, potentially. But that's something that would be easily recognizable by you and obviously by the patient as well. But it would not be a contraindication to doing this therapy.
Okay, that's really useful. Thank you. And when we start work with any new client, we go really slowly. We don't jump into any sort of rapid eye movement straight away. We talk about their history extensively, and then we try little exercises where they're not even moving their eyes. They're just kind of getting used to dipping into those past memories and coming back. So we wouldn't ever just jump into it and then just see what happens. Okay, that's been really useful. Perhaps you want to also tell everybody how you've adapted to the current COVID crisis. Can they still come in and see you for any appointments?
Yes, so obviously our office, just like every other colleague of mine and other specialties have had to adapt to the current environment. And we are very, very sensitive not only to our patients' health and well-being and psychological comfort, but also our own and our staff. So certain precautions have been made, which are being adjusted according to the state policies and so on. We are open. The office is currently open to see patients. We still prefer to see patients on telemedicine platforms. Most of my follow-up patients, the patients who already know me very well, whom I've seen before, are very comfortable seeing me in this manner. However, a lot of the newer patients whom I've never met before do choose to come in person, and we welcome them, and we make sure that we screen them out accordingly every time they come in. A temperature is being taken. We do a little questionnaire about their health and the health of their family and the surrounding people. The office is unfortunately virtually empty right now, which is a good thing. There's not a lot of traffic, both car-wise and patients-wise. We do not have anyone sitting in the waiting rooms, and everything is being completely disinfected and cleaned after every single patient. So we really go far and beyond, above and beyond what we should be doing in this situation. All of the patients who have come in, they all have to wear a mask, and as I do myself, if we do ever need to do a procedure, that's also being done completely sterilely. So I so far have heard only positive responses from my patients, and we are definitely open for business, and we welcome new patients and anyone who may have an emergency or who just wants to come for even a second opinion. We're happy to see them.
Okay, that's great. And I want to add about my own practice that I am still, unfortunately, virtual only. My office in downtown Ridgewood is sitting empty. At the moment, I'm still only seeing clients, new and existing, via confidential portal, via the computer. Perhaps you want to tell me how anyone can get in contact with you if they think someone may need your services.
Sure. Can flash my information somewhere. But, so the phone number for the office is 201-444-0868. It's fairly easy to call and select the option to make an appointment. There will be, unfortunately, some paperwork that needs to be filled out, which is the case everywhere at this point. And a friendly assistant will call you and set up an appointment, either virtually, giving some instructions as to how to set up the virtual appointment online, or what the instructions and procedure is to come in for a live visit. My office is right across the duck pond. For those who know Ridgewood, there's currently plenty of parking. We do not have any problems with parking. On a normal situation pre-COVID, we have a very good valet service, which right now is not the case. So you would be fully responsible for parking your own car, and in the comfort of your own car, basically. You don't have to give it to anybody else. So we have a lot of partners. If you'd like me to just mention, I actually have 17 partners, and we are all general practitioners. Some of us are pediatric practitioners, and we are also subspecialized in various diseases and conditions, and if necessary, we do consult with each other. So I think you would definitely have a pick. We're the largest group, neurology group in Bergen County.
Great. Thank you for that, all that information. Yes. Yeah, that's very useful. Right. And if anyone wants to get in contact with me, I've got my website, which is www.exploretransform.com. There's an online booking facility there, and my telephone number if you need to give me a call to ask any questions before you make that booking.
That's great.
Thank you so much for joining me. That's been really useful and informative. And
thank you
good
for
luck
having me.
And
I love this platform. I actually feel very comfortable talking to you this way.
So do I. Yeah. Okay. Thank you very much.
Sure. Thank you.